I'd like to spend a few minutes and share some information I have from other sources regarding problem identification and the context of the problems that bring individuals to us for help. In our society today, there are many different contexts that involve economic, political, and social issues which have dimensions and influences upon our clients' lives, and oftentimes underlie the issues that bring an individual to us for assistance. These disparities in economics and healthcare and education are just some of the areas that affect these individuals. Eileen Gambrill, in her text, talks about our tendency as a profession to biomedicalize behavioral problems and simple issues so as to bring them into the area for treatment when perhaps other interventions are more effective and much simpler. How those problems are framed changes as popular ideas change. So we have to look at who benefits from these changes and who loses in those changes. Ask ourselves, are we solving problems or are we designing and setting problems? Gambrill points out in her text, to give a name to a problem is to recognize or suggest a structure to deal with it. Here's a good example today in our society when we look at the issues involving social protests going on around the nation since the death of George Floyd. Some individuals refer to those protests as riots and emphasize and perhaps overemphasize the destruction that might have occurred in some of those protests. Other individuals see it as a justified response to untenable situations where oppression has ruled our existence for too long. How we view this problem, how we see it, are they agitators, are they radicals, or are they protesters demanding to have a voice that they have a constitutional right to have? Those kinds of ways of framing the issue has a lot to do with how we treat those issues. Are welfare recipients lazy? Or are they uneducated? Are they victims of economic structure instead, where the distribution of affordable housing and employment with decent wages is inequitably distributed? You may know that our society and its capitalist system requires that there be an unemployment rate of around 5% in order for our economy to function properly. Now, the unemployment rate is made up of individuals who are seeking employment, actively seeking employment, not individuals who are at home and who don't want to work or who can't work or who are too young or too old to work. These are people of working age that have the ability and the desire to have a job and who are looking for work. 5%, 1 in 20 individuals who want to work can't if our society is going to function properly. That's the way our economy is designed, the capitalist system. And so you see that sometimes deciding that people being on welfare is simply a matter of them being lazy, simply a matter of them being unmotivated, is really a way of framing the problem that really becomes quite destructive to the individual and really doesn't address the underlying issues that have to do with being on public assistance. We should look at and recognize how policies and practices tie into these issues and how it impacts how we frame the problem and what intervention we might pursue. It's very important for us to keep that in mind. Garfield said the conditions said to define the social problem are socially constructed and are one of several possible realities, an accompaniment to social control, to the quest for hegemony. If we don't understand the context of an individual's problems, it's very easy to fall into a stance where we blame the client and focus upon changing the individual rather than considering whether we should be looking at empowering the individual to work to alter environmental factors, whether we should be looking at the need to intervene with our society and our legal system and our social system in order to alter those environments that oppress the individual. Political issues in the biomedicalization of our problems are transformed into social or biochemical problems oftentimes. Behavioral issues arising from the environment suddenly become mental health issues, and domestic violence blamed on a victim or seen as a simple anger management problem with a perpetrator rather than as an issue regarding gender relations and our understanding of the family system. A basic concept in Sociology 101, when you look at deviance, is that deviance is also a social construction. It isn't something that is objective. And what is defined and labeled as deviant depends upon the group, the culture, and the circumstance in which the behavior occurs. One behavior may be a law violation. From a religious standpoint, it might be considered a sin. From other standpoints, it may look like it's a mental health problem. And so how we define the behavior that we see also has to do with how we respond to it. Do we respond to it with incarceration or treatment or other such things? The Biomedical Complex has defined many problems in living to be health problems that require medical or professional interventions. We should understand that as individual service providers, direct service providers in social work, oftentimes we are a part of that biomedical complex. Some of you may recall Urie Braunfernbrenner's theory of the ecological systems, and I just wanted to remind you of this. This is something that I know you've seen before. When we frame the problem, there are many different ways identified to focus for interventions, and level one is the individual focus on the person. Oftentimes, this is the thing that we think about when we think about getting into clinical social work, working with individuals who need some interventions. Level 2, focus on the family. Level 3, social groups and community. Level 4, the service system. And level 5 is the political, economic, and social system, policies and legislation that impact all of us. And so you see each of these systems emanate from the center of the individual, that microsystem. And so each system, micro, meso, exo, and macro system, have an impact upon the client and upon us as the individual. The individual interacts with each of those systems, and likewise those systems interact with the individual positively or negatively or neutrally. Often the work that we do with an individual in the ecological model, in the person and environment model that we talk about a lot in social work, really has to do with working with the interactions and relationships between the individual and the different systems that exist in and around that person. Another thing to point out, the chronos system, which really kind of tells you also that where you are in history also impacts the individual and how those systems interact with that person and see that person's behavior. So as this slide points out, confining attention to levels 1 and 2, that is the micro and macro system, really results oftentimes in an incomplete assessment and a selection of ineffective interventions. And so this would suggest that we should always make sure that we consider the exosystem and the macro system as well as the chronosystem in creating our assessment. Some theorists suggest that emphasis on the individual as the source of the problem is what explains the overrepresentation of poor persons and minority individuals in institutions. We're blaming the victim for the problems that exist because of the way the system works. Organisms make their own environments, they define them, they create them, they change them, they interpret them. This is also a suggestion that the individual is not powerless in the interactions with the system, but can have agency. And part of what we will do as interveners is to help those individuals, our clients, find their sense of agency and empower them to interact more effectively with others in their systems. Discrimination and oppression based on skin color, gender, social economic class, sexual orientation, gender identity, physical ability, age, and there are other issues, lookism also certainly, are all everyday realities. These covert interactions, or what we've come to know as microaggressions, are situations where people are treated differently because of these characteristics, something that we need to acknowledge in our work with clients and minority groups like this. Despite being dealt uneven hands at birth, the view is that the lack of individual initiative and responsibility creates and adds to the problems. This has to do with our American values, and I perhaps should consider presenting those slides once more, because those of you that have had other classes with me have seen the 9 American values presented. I might bring that over and share that in a future week. These are beliefs that we have about life and how individuals should be that are based upon American values. And even though we may reject many of these values intellectually, they're part of all of us. It's a part of our fabric. And one of those American values is this belief in rugged individualism and this sense that if you just try hard enough, if you work harder, if you do more, everyone can succeed. No one is held back by the system. And if somebody is poor or somebody is destitute or can't seem to get a job or whatever, it's really only their own problem, and they need to do things about it. And so we tend to, rather than looking at the larger system and how it impacts the individuals within it, we tend to blame the individuals who are not succeeding in the system, aren't benefiting from the way the system works. But there are a lot of structural issues that contribute to the human condition. And here's a list of just a few of the things that have been going on in the last few decades. There's an increasing concentration of wealth in the hands of the upper class. We seek our identity through purchases, and that oftentimes impacts individuals who don't have any ability to make purchases. Tax cuts that are presented by the federal government routinely benefit the wealthy and do little to help the middle class, much less assist the poor at all. Oftentimes, individuals, the poverty programs and programs that provide social services, such as Medicare and Medicaid and SNAP benefits and public assistance, are blamed for the budget deficit, despite the fact that we spend trillions on our war machine and other kinds of things. There's a lack of employment opportunities. Certainly that's increased since the pandemic hit our society. There are different educational opportunities that are based on social and economic class. An individual growing up in a poor neighborhood is not going to get the same education offered that will be offered to an individual who resides in an upper middle class or middle class neighborhood. Conditions in the inner city presents limited economic opportunities to the individuals who live there, who can't afford transportation out to where the jobs may be. Health problems exist that relate to inequalities and unequal access to health care, and this also has been emphasized with the pandemic as of late. For members of minority groups, any given level of achievement requires greater effort and provides fewer opportunities. Different views of behavior have different consequences in relation to how people are treated, and this is something we must keep in mind as we assess what is going on with persons that come to us for help. We must be wary of simplistic causal analysis in understanding people and their concerns and the social problems that exist around them, and instead integrate the views that consider multiple levels of causality. There are a lot of different theories about behavior that differ in many ways, and as we work through the textbook and look at the many different ways of intervening, you may be able to see that each particular theoretical perspective has a different view on what causes problems in behaviors. One system may believe more or less that the degree to which a problem is viewed is knowable, and other systems think it isn't knowable, that it's buried deep in the subconscious and may take years to uncover, if ever. They differ in how goals are pursued, what constitutes an acceptable evaluation or assessment, what range of problems would be addressed, how important the factors such as psychological issues, biological characteristics, evolution, development, environment, social, cultural factors, history. Each of those theoretical perspectives are going to have a different view of which is most important, which is least important. Different views on how much change can be expected and how much critical testing of claims is possible and valued. That gets into the evidence-based practice area, which we have heard already in our class. There are some who aren't comfortable with evidence-based practice, even though that is sort of the thing that is pushed forward in schools of social work as of late. How easily service guidelines can be developed, what kind of connection do we find between theory and related knowledge. All of these kinds of things differ from one theory of behavior to another. Some physical explanations for behavior include genetic, a sociobiological theory that reproductive success is the main determinant of the development of traits. So this implies really an individual is kind of stuck with whatever traits and characteristics they have, and there's not a whole lot you might be able to do about their behavior. There are a lot of theories out there that legitimizes inequality as a biological inevitability, that the minorities are minorities and don't fare as well in society because they are genetically less successful, let's say, less adaptive. I heard early in the pandemic a physician in New Orleans who was treating African American victims of the coronavirus saying that, yes, there were certainly more individuals that were African American that were dying from the virus, but that this had to do with the fact that they were genetically predisposed to some of those underlying factors such as obesity and diabetes, and it didn't have anything to do with the social or economic conditions with which they must exist. It was just horrendous to hear that. So this is sort of the epigenetic view that says that environmental influences are key in contributing to gene expression. Biomedical issues also is another physical explanation that behavior disorders and mental illnesses are seen as a medical problem due to a chemical imbalance often enough. So here again, we see the individual as the patient, as the cause of the problem. And this is something that fits very well with the philosophy that the capitalist system pushes upon us, that it's the individual's responsibility. There's really no need to change capitalist system, and that, of course, reinforces the status quo. If there's a brain dysfunction, perhaps it should be more a domain of a neurologist rather than a psychiatrist or a social worker. Other physical explanations include developmental. Individual development through our life transitions are contingent on the environment, but there's a lot of disagreement about how much emphasis should be placed on genes, environment, and interaction of the individual organism. The lifespan development views are very popular in the social work field as the basis of the human behavior in the social environment classes that you'll have or you have in the social work program. There are variables that are known as marker variables, such as social class and age, that correlate problems but don't necessarily explain why they occur. There are cognitive explanations that involve behavior, so that bizarre behaviors in this way of seeing behavior. Bizarre behaviors are adaptive in many respects when they're reinforced. So to understand the behaviors, you have to discover the relationships between the behaviors and their antecedents and their consequences. Behaviors are learned and maintained in this manner, and understanding this helps us to avoid negative labels for clients. The question is, do thoughts play a causal role in explaining behaviors and feelings? Some behavior and learning theories suggest that there's a reciprocal interaction between people and the environment, and that is that we both influence and are influenced by our social environment. Gender, class, culture, race all have an influence upon how certain behaviors and the rights to engage in those behaviors are viewed. Think about the example that is suggested here, that white middle-class people can purchase medications prescribed by their physician to alter their moods if they're depressed or they're too anxious or whatever. But African-American youth that live in poor neighborhoods are arrested and imprisoned for using street drugs for essentially the same purpose. This is an example of what we're talking about regarding the interaction of culture and race and how behaviors are viewed. There are contextual explanations for behavior that highlight the interactions between people and their environment. Like the ecological model, both personal and environmental characteristics are considered important in these views and are mutually influential. There are different levels of our environment, like we had just seen in the previous slide, that have unique characteristics and may influence other levels in the person's system. The person and the social are interlinked, and that if psychiatry isolates the individual and leaves social problems and conflicts untouched, personal problems become commodified. In other words, it's an income generating situation for those of us in the helping field. Appreciation of the connection between the personal and the political helps us to avoid focusing too much on psychological and biological characteristics with our client, and to avoid overlooking the important influence of the environment. A few slides about trauma-informed care, and this is something that you're going to hear from class to class, and I believe I know we have a class on trauma that's very important for you to take, but more and more in the last decade or so, we've become aware of the impact that trauma has on individuals and have begun to understand and perhaps reinterpret some of the behaviors that we have seen. A good example of this is behaviors of kids in foster care who have been abused and those types of situations. And so just a little bit about trauma-informed approaches and awareness of the impact and consequences of traumatic exposure, and of a history across settings and populations. Services are person-centered and strengths-based. The approaches recognizes the prevalence of trauma in individuals' lives. Now, there are certain principles of trauma-informed approach, and that is ensuring the safety of the individual and safety in the treatment relationship as well, establishing trustworthiness and transparency, ensuring that there's peer support and mutual help, collaboration and mutuality, empowering the client, giving that individual a voice and choice, and then cultural, historical, and gender issues all have something to do with how we approach trauma and treatment. In type 1, the individual retains complete memory of the experience. In type 2, repetitive, prolonged exposure to trauma with intense reactions. And type 3 trauma is the multiple pervasive violent events from childhood through adulthood. The impact of these situations can result in changes in the neurobiology of brain. There is evidence, for instance, that very young children, infants, exposed to violent atmospheres, violent environments, have actually shown changes in their brain makeup, their brain biology, when that exposure has been repeatedly incurred. And so if a child is in the next room, an infant is in a crib in the next room, and there's domestic violence going on in a neighboring room, that kind of yelling and violence that goes on, the infant is aware of that. And over a period of time, they're seeing that there are changes in brain development because of that. Certainly, there's a lot of social, emotional, and cognitive impairment. Individuals who've been traumatized often are stuck in the fight or flight mode of their brain, and so it's hard for them to focus on things like, for instance, paying attention in class or learning things or doing a good job at work, when there's also this thing going on of always being ready to respond to a perceived threat because they haven't really successfully still dealt with the trauma they've lived with. And sometimes health risk behaviors are adopted as coping mechanisms, antisocial behaviors, risk-taking behaviors, and those kinds of things, which create a whole other bailiwick of issues. So the response of the individual depends a lot upon many different factors, including one's age and stage of development. For instance, children that are very young might have more difficult time in dealing with the divorce of parents than a child who is 16 or 17 who may have an intellectual capacity to understand what's going on in that relationship and why that divorce has become necessary. How severe was the traumatic event? Was there violence? What level of force was in the violence? Did it occur once or has it occurred repeatedly? What's the relationship, the nature of the relationship with the person causing the trauma? Oftentimes individuals, those that experience abuse, for instance, at the hands of someone who is close to them, who they rely upon and trust, is much more harmful psychologically than an act of violence by a stranger. That makes sense in many respects. How do others around the victim respond? That's another very important factor. Are people supportive? Do people believe what happened to the person, and so on? What kind of help is there? Is there any intervention provided? All these kinds of things come to bear in terms of the response of the individual. Here's a slide with a number of trauma-informed resources, and many of these are familiar to you. In case you would be interested in keeping this slide handy, you'll find it in the weekly course content later on in the course. Just a couple more slides and we'll be done. Gambrel, some theories of behavior. 3 kinds of statements when we think about problems occur. One is a factual statement or a factual question. As an example, did the father assault his child? The conceptual question, why did he do it? And the evaluative question, was what he did right or wrong? Gambrel says that the questions of fact, what is, and the explanations, why it is, differ from those of values, which is what should be. She suggests here that the evaluative question is a question of value. And she believes that the further we move from facts when we're assessing a client situation toward theories, explanations, evaluations, the more removed we become from our concrete data. We have to be sure that what we know is indeed factual, or we are led to faulty thinking and poor decisions. There's a quote from actually one of my former professors in the textbook, Walter Hudson, who said, I had a class with him on empirical methods, in fact, in my master's training, and his famous line at the time, and still is, if you can't measure it, the problem doesn't exist. And this is sort of the same thing. He was very big upon thinking concretely and said that we get lost and confused sometimes when we begin to use words that don't have a concrete referent. That is, every word we speak, he believed, should be able to relate to something we can see and hold and touch. As we move further and further away from those concrete reference, the more vague and questionable we become in our communication and in our understanding. The more concrete in our description we are, the more clearly we can describe what a person has done. The more we have a concrete referent in our speaking, the less chance there is for confusion about what meanings we and others are to take from a statement about behavior. When you go into a home of a neglectful parent, perhaps, and I've seen case notes where the workers will say, this is the filthiest home I've ever been in, and it felt very much like it was very easy for the child to pick up infections from just the various things that existed around the house. There's a lot of values and a lot of opinions in that statement, whereas another way to write that note would be, there were dirty dishes in the sink, there was crusty food on the table, the toilets were backed up, there was sticky material on the floor that my feet stuck to as I walked across the floor. The more concrete we are, the less we can be challenged in our notes, and the more clear it is as to what the nature of the problem is. And so finally, why is it that we don't have this contextual perspective more often? Gambrel said, and she was pretty opinionated about her belief in our field, she said the light shed may be far too bright for those profiting by deceiving others. And she really has a tendency to be concerned about the fact that we, in our profession and related professions, medicalize many problems. And it is to our benefit to do that. Contextual views can be ignored or suppressed by public officials because of the social, economic, and political factors. They don't want to have to work on changing those things, and so they ignore context. And workers have to balance caring with a realistic appraisal of what can be done and find other workers that think similarly to them to create a support network. Sometimes there isn't much we can do about these things and we have to be realistic in our work, but we certainly need to keep an awareness of it as we deal with other individuals. If we don't critically evaluate our theories and assumptions, she said, those assumptions become prisons that limit our vision rather than tools to discover what is false. So those are just some extra thoughts for you this week. I hope that listening to this was of some benefit to you. If there's anything that spurs a thought in you or questions that might arise, I hope you'll bring it up in one of our class meetings. Thanks.